A very good morning to you, and thank you so much for joining us for yet another edition of the Glaucoma Awareness Program, which comes to you on Solid 100.9 FM every Friday morning. It's a cold Friday morning. It's raining right here in Enugu. I don't know what the situation, what the weather condition is where you are. And this Glaucoma Awareness Program is brought to you in partnership with the TESH Glaucoma Foundation. TESH is an acronym for the Eye Specialist Hospital. Every week we shine the spotlight on one of the world's leading causes of irreversible blindness, and that's glaucoma. Now, glaucoma doesn't announce itself loudly. It's called the silent thief of sight because it creeps in without warning. But the good news is, with proper awareness, early detection, and effective treatment, blindness from glaucoma can be prevented. So today our focus is on laser treatment, one of the modern solutions for managing glaucoma. And while traditional management includes medication through eye drops and surgical procedures, laser therapy has emerged as a middle ground, offering precision, effectiveness, and less invasiveness. But how does it work? Who is it best suited for, and what results can patients expect? And to help us unpack these questions, we have with us Dr. Suhanyo KK, an eye specialist, of course, an ophthalmologist, who has been at the forefront of creating awareness and offering care to glaucoma patients. Dr. Suhanya, good to have you this morning.
It's a pleasure to be here once again.
Okay, so for the benefit of our listeners, I'd like you to briefly explain the three main approaches to managing glaucoma: medication, surgery, and laser treatment.
Thank you for that question. First of all, we have come a long way in this program, yet let us remind ourselves glaucoma is the leading cause of irreversible blindness. Let us remind ourselves that glaucoma is the most leading cause of irreversible blindness all over the world and in Nigeria. And once you get blind from glaucoma, you cannot reverse it. That's why we take our time educating individuals so that we can keep our sight intact and keep seeing. Now, back to the question of today. What are the three treatment options available for glaucoma? Yes, we have three modalities of treatment, and they are: one, medical. When we say medical, most of the time what we are referring to are eye drops, and we have the eye drops. Sometimes you may have some tablets that go with it, but the mainstay is, as a matter of fact, eye drops. If the pressures are high, some medication in forms of tablets come in. Then we have the surgery. Surgical option is also available. Surgery means we are going to make an incision, a cut into your eye, such that we can create an opening in the eye so that your eye pressure will be reduced. Then the third option is the lasers. Lasers, as it stands, is a form of light treatment, and in this light treatment, a beam of light is condensed and sent into the eye. It is a minimally invasive surgery. What do I mean? Is it really a surgery? Is it a medical treatment? Sometimes it is actually we are making an opening into the eye, but with the help of light, so you don't really have the pain of going into theater, somebody cutting your eye and closing it up or anything like that. It is very, very friendly more like you come to the hospital now and you go home that very day. If you are working,
That same day?
yes, 30 minutes, 40 minutes, just you can go back to your work. It is as friendly as that. So it is very important to know that such treatment options are all available. Just for the benefit of all the listeners, glaucoma causes, there is raised intraocular pressure in glaucoma, and all the treatment option aims at reducing the eye pressure such that there is no further damage to the optic nerve.
Okay.
The optic nerve is the nerve, the wire that supplies the brain, supplies the visual signals to the brain. So that is the nerve responsible for us to know whatever we are seeing. I'm looking at you and brain is interpreting just because the nerve is intact. It's just like this electric bulb, the wire.
So once the nerve is damaged, the brain and the eyes cannot
coordinate once again. So there is a challenge. So the nerve health is what we are interested in, and maintaining a healthy intraocular pressure is very important in the management of glaucoma. So most of the time when you see an eye doctor, if you are diagnosed of glaucoma, the doctor first of all would have done several investigations, and he would have concluded these are your findings, and based on your findings, this is your target pressure. Target pressure is the pressure that, based on all the parameters and the health of your nerve, the doctor calculates and sets it. This is the pressure below which there will not be any damage to your eye. So it is an important number you must always take note of. Once you take note of that, any treatment is aimed at bringing your pressure to that number. So it is very important to know what your target pressure is in whatever treatment you are receiving. As long as you are within the target pressure level, then your damage will not continue. If you overshoot the target pressure, then there are likelihood of damage continuing, in which case doctor might now switch your medication. Sometime has to go to the surgery, sometime medications and laser. So it all depends on the stage, severity, and the target pressure. These are all the factors we consider when we are treating our patients.
Okay, the target of whichever approach is to reduce the pressure, right?
Yes.
Okay. And if the whatever means that is used succeeds, that means you have achieved that lowering of pressure.
Exactly.
And that means there will be no further damage.
Exactly.
But if you don't achieve that, it means that there will be further damage.
Yes.
Moreover, glaucoma treatment cannot restore what is lost. It can only safeguard what is remaining.
That's
Am
the
I
point.
Right?
You are 100% right.
So I'm a good student.
Very good student.
Okay, so how available is laser treatment in Enugu and Southeast?
I know it is available in Enugu.
Is it available?
Yes, Eye Specialist Hospital has it in Enugu. I don't know of other centers, but
is it available in a place like Esu Teaching Hospital?
No, it is not available. Teaching hospitals don't have the lasers, but lasers are available.
People are scared of two things. One is the cost. It appears expensive. Secondly, people when you say laser, people are like scared because it's like you're shooting something into their eyes. Okay, but then so you might want to talk about how safe it is to go through laser.
Yes, laser, as a matter of fact, is a light treatment. It's a light treatment, and what I mean is you have a collection of light, a beam of light going into going into your eye, and you actually sit down. You don't lie down, depending on the type of laser you are doing, but you actually sit down. Usually some eye drops are placed in your eye before the laser, like 20 minutes, 30 minutes, to numb the eye. Numb the eye means you don't feel pain or anything. Okay, unlike traditional surgeries, you make the person to sleep or give injection. Here only eye drops are used. So once the eye is okay, then the patient sit down on a machine that is looking more like a slit lamp. Slit lamp is the basic instrument an eye doctor uses to examine the eye, but in this slit lamp you are going to have laser rays coming into the eye. Now, it is not a scary machine, it is just a friendly machine. And it is not isolated. It stays around the theater area just because of laser safety issues. Apart from that, then usually you are asked to position your chin on the machine, and there is a lens that is used, and the essence of the lens is condenses the light ray that goes into the eye. You remember, laser is precision technology. It is most of the time we have heard laser sharp. It is very precise, and if you want to make an opening in the eye, we are very sure of looking into the structure with the help of that lens, and we are only aiming at the trabecular meshwork. That is the area that is in question. That is the drainage pathway of the eye, and you aim the light beam into the meshwork, and you actually fire the light into the trabecular meshwork. So you are seeing what you are doing, and it doesn't even extend to the next point, because it is the lights don't, if they don't come together, if they are not precise, it is not going to cut. So it is as precise as that. So you go in, and it creates an opening, and you go round the eye and come out, and usually it is on a normal note, it cannot exceed more than 5 minutes to 10 minutes. You are out of the yes.
That fast?
That fast. And some of the lasers may not even take 2 or 3 minutes. So sometimes patients wonder,
has it happened?
Has it happened? Why? What is happening here? Everything is over. And it is so friendly, because after the laser, you go in, check your pressure. 30 minutes later, you check your pressure, and you are not even given any medication. Bye, go home. Maybe sometime you can have some little reaction, some reaction to light or something like that can be there. It's not that you wouldn't have any symptoms. That is on very rare occasion you have. Sometimes you can have redness, tearing, but they all fizzle out within few days, and you are back. And most of the time there is no medication attached to it. You come back 1 week or 2 weeks after we check your pressure. After that,
sounds like magic.
Yes, 3 months we keep monitoring you, because there is no treatment you take in glaucoma. We can confidently say bye-bye, because we want to be sure this treatment you have gotten, can it really bring down the eye pressure to the desired target, because that is important. Because no treatment you do, you are supposed to go off the radar of the eye. So it is quite safe and very friendly. It is risk-free, So, unlike the olden day lasers, they had the problem of scar formation, and because of that, you wouldn't want to repeat it. In the present lasers that are available, you can really say that it doesn't form scar, and you can actually repeat the laser if the pressure control you think is going down. You can come back for a repeat. Now, you asked a valid point whether it is cost effective, not cost effective. Yes, when you are taking medication, most of the time patients are never on one medication, and medications have long lasting side effects that alter the surface of the eye. And because it alters the surface of the eye, the patients come with a lot of complaint. You now add more eye drops to the eye in the long, and these eye drops, if you are a very judicious user of eye drops, and an eye drop a bottle cannot exceed 28 to 30 days. That's the way pharmaceutical companies have structured it. I think the cost of the drug itself is expensive, so it is really packaged either as 2.5 mils or 5 mils, and you are going to be buying this medication every month. Most of the time patients are on 2 or 3 medication, glaucoma medication, along with tear supplement, because glaucoma medication goes with what you call ocular surface disease. They irritate the surface of the eye, and the eyes go red, and we are not talking about the side effects attached to any other part of the body. Sometimes these drugs also have problems relating to your heart. We are very careful when we are prescribing the drugs because it can bring down the heart rate. It has a lot of, if you have asthma, you want to be careful. In the long term, sometimes it causes drowsiness, sedation, reduced sexual desire, and all that problem. So it is a safe option when you have an option other than medical treatment. When you say medical treatment is friendly because you are carrying it, but the other challenge you want to look at it is because some are once daily dose, so it's fine, it is more convenient, but unfortunately not all the patients, very few patients are on once daily dose drug. So many are on at least 2 medication, and you must remember this medication to work effectively morning and evening, sometime morning, afternoon, evening. And we are not living for the drug. We are we are not living for your eye condition. The eye condition is part of you, and you want this thing to be part of you. So it is not always easy when you are leaving your house. You want to carry the 3 eye drops and put it in your bag and run. Sometimes you have forgotten in the place where you have gone to. Sometimes the drugs itself loses potency when exposed to sunlight. So it is not an easy venture, but we encourage patients because we also know that it's not all the time we are disposed to doing laser, but it is good to know if you have an avenue, you can do it because it is really helpful. So cost in the long run, if you compare it, the lasers will be more effective because in the long run you have done a procedure. And
does it cost up to $1 million?
Far less than that.
Far less than that. Okay. Are there different types of laser procedures?
Yes, we have.
For glaucoma, and how do doctors decide which one is suitable for a particular patient?
Yes, glaucoma in itself have different types. We have the open angle glaucomas, and broadly you have the open angles and the angle closure glaucomas. So naturally it cannot be the same type of laser for every glaucoma. Now, those that have higher eye pressure and the angles are open. Once again, I want to mention that open angle means, in the eye, there is a pathway through which the aqueous humor, the fluid that maintains the eye pressure, is formed. It is secreted by the ciliary body. What happens is, when it is secreted, it has to go out of the eye. There is a balance we need to have. If you don't really have this balance, eye pressure can go up. So it is like in the case of open angle glaucoma, there is a drainage channel in the eye, but the systems are open. It's like a kitchen sink. The filter is open, but for some reason it's not filtering. We go and call the plumbers. The eye doctors are the plumbers now. Okay, now in the case of angle closure glaucoma,
to unblock what is blocking the sink.
Yes. So in the case of angle closure glaucoma, there is a visible blockade, and it can truly give you pain. The angle closure glaucomas are very funny. They don't give you any symptoms also, and the blockade can cause sudden rise in pressure, such that the pain can be so sharp, and you may not be able to do anything, and you can lose your sight immediately. It is as bad as that. So the type of treatment you offer in the case of angle closure is different from the type of treatment you offer in the case of open angle. In open angle, you are creating an opening, additional opening, so that the water will leak out, go out, and maintain a stable eye pressure. That is, we call it the laser trabeculoplasty. We call it selective laser trabeculoplasty because we are looking at the filtering pathway. There is what you call the trabecular meshwork. There is one that have the pigmented trabecular meshwork. Pigmented means it has some melanin that gives the skin color. It is there. So we target the pigmented trabecular meshwork. So that is what we do in selective laser trabeculoplasty. I told you laser is precise, so it goes to target only the pigmented trabecular meshwork and not the non-pigmented one. So that is why it is a precision technology. Now when it comes to angle closure glaucoma, we are looking at the angle still, but now you know that there is a visible blockade. But normally the doctors who treat glaucoma, they do angle assessment of the eye. They do a check called gonioscopy. Those that have passed through will know there is an instrument that is kept on your eye, and that eye which check the angles of the eye, whether it is open, whether it is closed. And because any glaucoma patient who is receiving treatment ought to know the type of glaucoma you are having. Am I having angle closure? Am I having open angle? Because treatment is different, and certain aspect can be similar, but there are some fundamental difference which the doctor knows, and he will have to address the problem as such. So in the case of open angle closure glaucoma, there is an opening that will be created on the iris. Iris is the black part of the eye, black or brownish part that surrounds the pupil. You create an additional opening such that the water that creates the eye pressure is let out. So once you do that, the patient feels better, and then sometimes some eyes are at risk. If one eye has angle closure, the other eye might not have given you any sign or symptom. Such patients are more at risk. So it's not that every person who has angle closure must do laser peripheral iridotomy. Iridotomy means we are making opening in the eye, but it's not everybody that is subjected to it. But there are some patients who we consider as high risk individuals, then these high risk individuals, they are subjected to laser peripheral iridotomy. Apart from these two lasers, then we also have other lasers. We have the transscleral cyclophotocoagulation, or just cyclophotocoagulation. Sometime for some reason you have done medical treatment, that is, you are treating your patient with eye drops and medication. You are treating your patient with laser glaucoma surgery. But for some reason, their glaucoma is so stubborn. The eye pressures don't really come down. Eye pressures really stand above 50, 60, 70. And at that point, patient is always passing through pain, redness, tearing. Pain can be so destabilizing. And at that point, we have to look at a different laser called the cycloablation. In the case of cycloablation, what we are doing is, that is, when other lasers cannot take charge, this is the option, and we now go and do cycloablation. What we do is, the ciliary body that causes secretes the aqueous humor, which causes the eye pressure, we go and ablate it, burn it off, so that it doesn't produce that fluid at the rate it was producing.
Okay.
So you can actually see, today the patient had a 60 eye pressure. You do the laser. That laser is a little bit more invasive than the laser peripheral iridotomy and the selective laser trabeculoplasty, because we give an injection. That is the only difference into the eye to keep the eye calm. Then it is also a procedure that is done less than 10 minutes, you are done. So once you ablate it, the following morning, today the eye pressure is 70, tomorrow morning eye pressure has gone to 10, 20. So the patient truly recovers a lot. He recovers a lot. And that sudden relief with pain and all that he was passing through has come down, so he feels a lot
of relief,
a lot of comfort. And sometimes these days we are also seeing doing it for sighted patients, but we need to be more careful doing it. It's a destructive surgery, but the surgeons try to be extremely cautious, and if that way you can practice it, it can be done also. But there is a modification to it, to that cyclophotocoagulation, that is also available. Is called the micropulse cyclophotocoagulation. Is a modification to the transscleral. Transscleral is continuous wave. The laser light is emitted constantly. Here it is in micropulse. You give it in pulse, in a short while. It doesn't last more than 2 seconds, just 2 seconds. You just go around and the deed is done. It is for eyes that have very high eye pressures and seeing eyes. There is a newer laser. So far results are very encouraging. All these things are available in Enugu.
Okay, I can only hope our audience can understand the jargons. Are there risks or side effects or limitations patients should be aware of before opting for laser treatment?
Just like everything in life, it is good you ask your doctor if there are side effects to any treatment you are receiving. And to my knowledge, the side effects of lasers are relatively far minimal, not just minimal. It's really far minimal. What do I mean? You don't really have side threat, especially the SLT, the selective laser trabeculoplasty, and the laser peripheral iridotomies. They don't have vision threatening complications, because sometimes we also see our patients when you offer them laser surgeries in the 2 eyes at once, they don't want to subject their 2 eyes. They are worried. Doctor, I'm not safe. Something entering my eye. I am not safe. But go, I'm sure the doctor himself doesn't want to blind anyone. So it is truly safe. That is why the procedure is offered. And you are going to walk with your two eyes open. You are not even going to have a bandage in the eye.
Okay.
What you can experience following laser trabeculoplasty is some irritation to light. That is possible. Some patients do complain about redness, tearing, but they all calm down. We don't even give eye drops. We give Panadol. Everybody is familiar with Panadol. So that is what we give if the patient complains of a complaint. Even laser peripheral iridotomy we do for angle closure glaucomas don't really have so much side effect. You can have some form of blurry vision, transient blurring, but which resolves with time. So those are sometime you can have double vision, but depending on the location of the opening, those complaints can be minimized. Where one has to be careful is the laser for painful blind eye, the cyclophotocoagulation. That one is mainly for those that have really gone through all the parts of all the treatment option, and all treatments have failed, and you are at the last bus stop and you really don't have any way to move. You want to reduce the pressure and existing treatment strategies cannot help. That is when you opt for it. Okay, that one sometimes can give you pain. Sometimes it can drop the eye pressure far too low. That is what we call ocular hypotony. That's from very high eye pressure to the state of.
If it gets too low, is it a problem?
It can give you a significant pain. So that is a challenge on its own. Sometimes it can give you cataract. After in 12% of the cases, it can give cataract after the treatment. So these are all recorded information, and we have also seen patients coming with cataract. But in the current studies that are ongoing and that have been concluded, it shows that there is what you call the light trial, laser in glaucoma and open angle glaucoma and ocular hypertension trial. It shows that those that have been, they subjected about 700 patients into two groups. Those that were doing lasers, selective laser trabeculoplasty, and the other group receiving anti-glaucoma medication. And it showed significantly that those that received laser treatment had better quality of life, better visual field preservation, meaning that the optic nerve head did not go into damage, and over a 6-year period they had better response and visual field preservation. So at the end of the study concluded that it is safe to opt for laser treatment as the first line of treatment for all our glaucoma patients who have open angle glaucoma and ocular hypertension. And then there is also glaucoma initial treatment in patients who have been on intensive medical treatment. That is, they have been receiving glaucoma medications, and then they did lasers, and they responded very well by a drop in pressure of 4 millimeters if their prior eye pressures were greater than 15. But if the prior IOPs were less than 15, that outcome was no good. But at high pressures, lasers do well. Patients do well with lasers.
All right. Welcome back. It's still a glaucoma awareness program. It happens every Friday on Solid 100.9 FM between 9 and 10 a.m. We have some minutes before the hour of 10. If you have a question for my guest, Dr. Suhanya, this is your opportunity to do so. Let's find out what your concerns are. We've been dealing with the laser option to treating glaucoma. And if you have a question, this is the time to bring it. 0909 771 1009, 0902 311 1009. If you are a glaucoma patient and you're having any kind of problem, even away from the laser option, this is your opportunity to also ask question. 0909 771 1009, 0902 311 1009. Let's find out what you consider a challenge. Okay, I have a caller. Hello, good morning.
Hello, good morning.
Good morning.
Yeah, this is Michael calling from MNA.
Michael from MNA, go ahead.
Yeah, I want to say a very big thank you to the doctor or prof in the studio. I've been talking about different laser options. I was expecting to hear her, speak on the age factor. Age factor, like, is it something advisable or possible for me, someone above 70 years and above, something like that? Okay. So that's your question. Thank you very much.
Okay, thank you for joining us. Dr. Suaya, you can go ahead and answer the question. But let's take this one. Hello, good morning.
Hello.
Hello, good morning.
Hello, good morning, UC.
Yeah, good morning.
Yeah, I get to correct from Enugu State.
Mr. Kechuku, go ahead.
Yes. Please, I want to ask doctor concerning the eyes, but there are people who say that ulcer can cause eye problem. So, is there any other ailment or sickness that can lead to eye problem? If they are, what are we going to do? Are that person going to treat the sickness, or the person that people that like the doctor there can also cure the eyes or cure the sickness that caused the ulcer? That's what I want to know. And also, where is he? Maybe where is the hospital that is being as a doctor, so that people can come there if there is anything. Thank you.
Okay. All right. Let's take some more calls. 0909 771 1009 or 0902 311 1009. Okay, let's start with these two that we have. Doctor, go ahead.
Yes, the first caller asked me about the risk factors. Can somebody who is about the age of 70 be can somebody who is about the age of 70 be subjected to a laser treatment? Why not? Glaucoma surgery is laser procedures are quite safe at all age group. What is who is not suited for laser is determined by the doctor. There are certain conditions. If the glaucoma is a secondary glaucoma, if it is as a result of an inflammatory glaucoma, your doctor will not subject you to doing a laser treatment. So it is the doctor that decides the type of treatment you are being subjected to at all age, whether it is you are a child or at extremes of age. Lasers are quite safe and very friendly, so no need to worry about age being a risk factor. Risk factor is when the eye condition itself poses a challenge for the doctor, then the doctor is not going to subject you to that procedure. Then the next caller, Mr. Ikichuku, asked whether ulcer can cause eye problem. To my knowledge, no, ulcers don't cause any eye problem. But sometime you may hear the word corneal ulcer. Corneal ulcer means wound inside the eye. It is not the same as the one inside the stomach. Maybe the doctor was talking about an ulcer. You thought it's the ulcer inside the stomach that has caused ulcer in the eye. No,
Okay.
they are two different things. Ulcer is a breach in the surface of an organ, so it can happen in the eye, it can happen in the other part. But the peptic ulcer disease that we are all familiar with, that cause irritation in the stomach, burning sensation, indigestion, and all that, does not cause any eye problem. But certain medical conditions like diabetes, hypertension, arthritis, these are conditions that can cause eye problem, and it is important to know that periodic eye evaluation with an ophthalmologist is important. Sometimes taking medications for a very long time can also cause eye challenges. So periodic eye evaluation, if you have a condition that is running for a long time, always go to an ophthalmologist, let them do a detailed eye evaluation.
Okay. That's it. The talk lines are still open. 0909 771 1009. Let me ask. Okay, there's a caller. Hello, good morning.
Hello, sir. Please. Good morning, sir.
Good morning.
My name is Vincent. I'm calling from Enugu.
All right, go ahead,
Family.
Vincent.
Okay, sir. I'm a patient with glaucoma for more than 4 years now. My case is that it doesn't irritate me nor pain me at all, but it's only always dark. I'm feeling that is darkness. I've gone to several hospitals. They say it's not operational. I haven't administered to me drugs that I was using for the eye drops. Every effect I can see is that I just roll back. It gets darker on me. So even my left eye, I'm not seeing it. The right one done the main list to managing. At the time, before, in a while, it will be. The stage now is that I'm just managing a little bit the working at. I can't be able to picture someone's face normal to know the person and condition I am. So I don't know what I can do. I just resort to eye drops and do. But instead of getting better, accelerating more. I keep on listening to this program and I hardly get to it when I begin to come. That is it, sir.
All right, did you
I
get
don't know
him?
what else I can do.
You got his
It's-
concern?
Yes, you said, yes, I understood your concern. You said you have been living with glaucoma and you are having challenges. You are using eye drop and your vision is always dark, and it appears it's only one eye you are using to see. I wouldn't know the stage of that eye in which you are to advise you, because actually you have to look into the eye and be sure this is the stage and the type of glaucoma. At some point, the point at which you present to the doctor is important to determine what you can really benefit from. So it may not be a discussion on the other radio station. It might be something you might have to come so that we can look at the eye and tell you maybe this is the way to go, and this is what other things we can do so that your quality of life can be better than what you are passing through.
Okay. Let's look at one more. Hello, good morning.
Hello, good morning.
Yeah, good morning.
Yeah, I call back.
Go ahead.
Yeah, please, I want to know, there are other things like people used to say that worm can cause eye problem. Or is there any stomach problem that can lead to eye problem? Maybe other worm or anything. And secondly, is there anything that somebody can be eating? maybe by what somebody eats, can it lead to eye problem? Like, people who eat proteinous foods and other things. Or does it mean that eye problem is of its own problem for its own? Or is there anything that, because it is better, it's very important that somebody should, they say that prevention is better than cure, so that that person can prevent that can, or whatever that can lead to eye problem instead of trying to cure it.
All right.
So is there anything that can, any stomach problem can lead to eye problem? That is my question. Thank you.
All right, let me just take one more and then we can quickly. Hello? Good morning. Hello?
Good morning.
Go ahead, we can hear you.
Okay. I just want to give you this one. I want to answer.
I can't hear what you're saying.
Hello?
Yeah,
I'm hearing you.
you're hearing me, but I'm not hearing you. Go ahead, be loud.
Okay. Okay, I just want to give you this one.
You just want to do what?
Greet you.
Greet you.
Okay, thank you.
Thank you.
All right, round up. We're almost out
Okay.
of time.
Mr. Ikechukwu, you asked about any stomach problem leading to eye disorders. No, they don't really have significant correlation, except your condition is as a result of autoimmune disorders. In the case of autoimmune disorders, your body is fighting itself, body is identifying itself as strange, so it starts fighting every part of the body that has similar structures. So it may be one of the things that can give you a problem in the stomach, can give you an eye challenge. And then you ask about what are the things that you should avoid in terms of your eye. One of the major things we encounter in Igbo land here is the issue of eating a lot of abacha that is not properly processed. Abacha contains a lot of cyanide, so it is eating abacha is again and again may not be very advisable in terms of your eye health. It damages your optic nerve in the long run. So if you are a frequent eater of abacha, you can cut it down. So that is one of the things. But otherwise, to stay healthy, it is better you take a lot of fruits and vegetables. They are green leafy vegetable, colored fruits, things that are very colorful, like rainbow colors, tomato, oranges, pawpaw, mango, green of assorted colors, ube, all those colored things can help your eye very well. So
Well, that's how much time will allow us to do today. Thank you, Dr. Sohanya. It's been awesome. It's been enlightening. And I'm sure a lot of people are more knowledgeable than they were when we started. And until next week, when we bring you another beautiful edition, another beautiful edition of our Glaucoma Awareness Program, we want to thank you for listening and do have a beautiful Friday.